What are the causes of piles? The common causes of piles include having a poor diet, which means you're not taking enough fruit and vegetable, you're also not drinking enough water, and this is what's responsible for strengthening and fortifying the walls of your bowel. There are other factors like lifting heavy, especially in builders, construction workers, people who go to the gym and you're doing heavy squats. Also straining if you're constipated, for example, and if you're pregnant and you're also constipated while pregnant. These are all factors that will contribute to your risk of having piles. And some of the common symptoms to expect would be pain on passing stools, especially if you're straining and your stools are hard. You can also feel pain on sitting, so it's uncomfortable to sit down. And in more severe cases, you might get bleeding, where you might have small amounts of blood like a teaspoon, or you might actually notice splashes of blood when you go to the toilet. In really extreme cases, you tend to get non-stop bleeding, which might go on for at least a good half an hour, and which happens frequently throughout the weeks or months. Also, you have to remember that most people talk about feeling piles on the outside, which sometimes can feel like the size of a grape if they're quite inflamed. But you can also have internal piles, which is piles on the inside. And when I refer to piles on the inside, I'm simply talking about the wall of your rectum. So in these cases, you would need an examination by your doctor. So your doctor would usually use a finger to feel the piles on the outside, but they would also have to go into your anal passage to feel if there's any piles on the inside, or any blood inside your anal passage will indicate that you do have internal piles as well. And if the finger cannot get there, in some cases they'll use a special equipment called a proctoscope to go in to look for any piles on the inside.